Buddy, thank you for watching the only hour of local news in Southwest Florida right now. As we learn to navigate the pandemic, a local pharmacist says he's seeing a possible silver lining to the coronavirus. Nolani Matthews went to talk with him and get some answers.
As we get closer to Christmas, you'll see it increase.
We hear it every year, the reminder to go get your flu shot.
And it really gets in high numbers January, February.
But in the age of the coronavirus, Cypress Pharmacy says the response looks a lot different.
When we went to administer the flu shots in October and November, we did more shots than we did all of last year.
Pharmacist J.T. Topola says flu season goes until February. But with this year's turnout, they've already ran out of their shots for seniors over 65, which require a higher dose of the vaccine. They've also noticed
people that normally wouldn't take it are taking it this year. And again, part of that is just the fear factor that goes along with COVID, that they want to protect themselves as much as possible.
He says a big fear is the double destruction of two similar viruses. The Centers for Disease Control and Prevention says when it comes to the contagious influenza and COVID-19, both affect your lungs and breathing. They commonly spread through close contact and respiratory droplets. They even share similar symptoms and treatments. And although they are two separate viruses, the most notable difference between the two is only one has a vaccine.
The flu shot cover every strain of flu? It does not. That's what they do is they base it on previous data, what's most likely to be the flu strain that year.
Coming down with the flu is more risky than ever before. Topola says it could weaken your immune system, make you more vulnerable to COVID, and risk your chances of fighting off both infections. Last flu season, the CDC says more than 34,000 people died and around 490,000 were hospitalized.
So with the flu shot this year, with everything going on with the pandemic, you need to protect yourself as much as you can. They're not exactly sure, nor do they have good protocols on how to treat both COVID and the flu if you were to get both.
On the contrary, he says similarities between COVID and the flu could also result in something positive. It all depends on whether people protect themselves from either one.
I think with a lot of people staying indoors, social distancing, wearing masks, washing their hands, it's going to drive the flu numbers down.
Which means the methods people use can help in more ways than just one. In fact, the pharmacy says it's something they already see.
It is there, but we're not seeing anywhere near the amount of flu that we've seen in past years.
Because in a season of two deadly viruses, such as the flu and COVID-19, they say prevention is the only safe way out. Reporting in Fort Myers, Nolani Matthews, Fox 4.